I'm just going to check. I'm just checking. It should be live now. There should be like a little latency of, but it should be live now. Yeah, it's live. So should we start? Hi everyone who's watching. I want to welcome you to this live stream from Shroff Eye Centre. We have with us Professor Ritu Arora, who's one of the most senior and the top cornea surgeons in the country. And we also have Dr. Varshini Shanker with us, who is one of the best pediatric ophthalmologists that we have. So let's start. Today's main topic is conjunctivitis. Anybody has any questions, please do post them on YouTube. Just post them as comments. आप कमेंट्स में अपने क्वेश्चंस छोड़ दीजिए. हम कंजंक्टिवाइटिस के ऊपर हम कवर करेंगे सब कुछ आज. तो आपके जो भी डाउट्स हैं, प्रॉब्लम्स हैं, आप प्लीज पूछते जाइए. तो लेट्स स्टार्ट विद कि कंजंक्टिवाइटिस होता क्या है. डॉक्टर रितु, कुड यू टेल अस प्लीज?
Hi. So conjunctivitis is basically just the inflammation or the redness of the outermost layer of the eye, and which is normally transparent, and it is covering that white portion of the sclera. So anything which causes inflammation, it may be infective, it may not be infective, and if it is infective, it could be bacterial, it could be viral, while otherwise it could be allergic. So conjunctivitis has multiple reasons, and but the common conjunctivitis which we are right now concerned about and are talking about is the infective conjunctivitis, and that's the viral form, the commonly occurring, and that is what we easily transmit from one person to another.
So, ma'am, right now, which is everyone's coming with a lot of conjunctivitis. We know we've seen a huge number of cases, more this time than usual. Usually, rainy seasons में आते हैं conjunctivitis के केस बढ़ते हैं, but इस बार कुछ ज़्यादा ही बड़ा spike हम लोग देख रहे हैं. तो इसका what is the commonest right now cause, which is why is it spreading so much?
Maybe Dr. Varshini, would you like to take this question?
Are not restricted even when you do have the conjunctivitis, because everybody wants to, be 100% with all their activities this year.
So can this conjunctivitis be COVID? Is what many people are asking.
I think it is unlikely. Most of the rainy season conjunctivitis tend to be adenoviral conjunctivitis, which is probably what it is this year as well. We don't really test for the cause of the conjunctivitis unless we start noticing alarming symptoms.
No, I did talk to the Communicable Diseases Center, and from one of the larger eye hospital, government hospital, where and they collected the fluid from the eye and it was sent, and it is found to be of adenoviral strain.
Okay.
Yeah, it's not COVID.
Yeah, it's not COVID, and also we are not testing really for COVID, so it's unfair to say कि ये कोविड की वजह से हो रहा है या कुछ भी. बहुत सारे viruses हैं जिसकी वजह से होता है conjunctivitis, and this time also most probably it is adenovirus which is causing.
No, COVID can cause conjunctivitis,
yeah.
And this was a common presentation of the eye during COVID.
Yeah.
But the current conjunctivitis is not COVID in origin.
Yeah, and so if someone does get conjunctivitis, तो इसमें symptoms क्या-क्या होते हैं? कैसे पता चलता है हमको हो गया है?
The common symptoms जो normally one starts with, कई बार सबसे पहले flu हो सकता है किसी को, थोड़ा fever, there might be mild sore throat, mild running nose, which may be going on for a day or two. फिर उसके बाद they start getting pain in the eyes. Commonly they present with pain in and around the eye, and everything is very acute. It all comes within hours. There may be swelling of the eyes, and there may be redness along with it. Sometimes some people's eye is very red, some are just pinkish, and then there is watering from the eye. And some people just get up that in the morning their eyes were stuck and there was a lot of discharge. So these are the common presentations they are getting. Very rarely they may have blurry vision because of the discharge. And they say when they blink the eyes, the vision goes down, but it clears up soon.
Okay. So, what can people do to prevent conjunctivitis? क्या क्या कर सकते हैं हम?
Yeah, Vaishni.
Actually, before I ask, I'll ask Dr. Varshini, are children more susceptible to conjunctivitis? क्योंकि बहुत बच्चों
तो
को हो रहा है.
हाँ, तो उसके लिए हमें यही देखना पड़ेगा कि कंजक्टिवाइटिस स्प्रेड कैसे करता है। तो ऑटोमैटिकली देन ये समझ में आ ही जाता है कि बच्चों को ज़्यादा क्यों होता है। तो कंजक्टिवाइटिस स्पेशली इस टाइप के जो वायरल कंजक्टिवाइटिस होते हैं, वो स्प्रेड होते हैं टचिंग से और फोमाइट से। मतलब कि जिसको कंजक्टिवाइटिस होता है, जो इन्फेक्टेड पेशेंट होता है, वो अपने आँख को रब करता है या हैंडकरचीफ यूज़ करते हैं या उनके पिलोज़ पे, मतलब बेसिकली उनका डिस्चार्ज और उनके जो वायरस पार्टिकल्स हैं, वो उनके आस-पास सब जगह लग जाते हैं। कोई और जो अनइन्फेक्टेड होता है, उसी चीज़ को टच करके फिर जब अपने आँख को टच करते हैं, तो उनको स्प्रेड होता है। एंड ऑब्वियसली हम समझ सकते हैं कि ये सबसे ज़्यादा बच्चों में होता है कि हम वो कंट्रोल नहीं कर पाते हैं कि आइज़ को टच नहीं करना है, आइज़ को रब नहीं करना है। और ऑब्वियसली उनके जो केयरटेकर्स होते हैं, उनके जो पेरेंट्स होते हैं, जो ड्रॉप्स डालते हैं, तो ऑटोमैटिकली जब मल्टीपल टाइम्स करना होता है, तो उनके हाथ में भी लगता है, उनके घर के सरफेसेस में लगता है। एंड जब बच्चे साथ में होते हैं लाइक इन स्कूल्स और प्ले एरियाज़, तो स्प्रेडिंग इज़ वेरी फास्ट एंड देन उनसे उनके फैमिली को। तो इसीलिए बच्चों में ज़्यादा देख रहे हैं, नॉट दैट चिल्ड्रन आर मोर ससेप्टेबल।
So, how does it spread conjunctivitis?
मैम?
Yeah. It, as Vashi has already explained, but it mainly spreads when we kind of share anything from person who has conjunctivitis. अगर उसका कोई भी, as she said, pillow or towel or handkerchief or maybe dirty hands, patient has rubbed it on the eye and that fluid is there, and then you pick up something else and the other person uses the same cloth, and that is a common source of spreading the conjunctivitis. Conjunctivitis can also be spreading from the eye clinics because वहां पर जहाँ पेशेंट्स जाते हैं अपने आप को एग्जामिन कराने, from there, though of course we are sanitizing, and so there also because the surfaces are contaminated.
Recording in progress.
When the surfaces are contaminated, so and another person goes and touches that surface, that's how the conjunctivitis is spread commonly.
Okay. And तो फिर इसमें what can we do to prevent? Coming back to the questions, कि कैसे prevent कर
Yeah.
सकते हैं हम?
So the most important way to prevent is when you don't share things, especially if I have somebody with conjunctivitis in my house. So please don't share any of the very close things of that person with yourself. And the best and the easiest way is to keep washing your hands as often as possible, so that your hands are clean. And if we are doctors, we keep sanitizing our hands, keep using those sanitizer after every patient we have seen, or whatever equipment on which the patient has been seen, that is cleaned after every patient, especially with alcohol. And if somebody has conjunctivitis at home, one person who has conjunctivitis at home, better if we can isolate that person and don't share any of the towel or any of the bed sheet or handkerchiefs or any of the clothes of that person with yours. Maintain safe distance. Same COVID precaution would be very handy at this time. Dr. Vashni, would you like to add something?
Yeah, so I have a list of instructions because, of course, we are seeing so many patients and children with conjunctivitis right now. So the most important thing is to not to touch your own eye as much as possible. So when people ask whether they should wear dark glasses or protective glasses, it does help because it serves like a physical reminder कि एंड इवन अगर आप अपने आँख को छूने की कोशिश करते हैं, तो इट इज़ अ फिजिकल बैरियर जिससे कि आप नहीं छू पाते हैं। So any which way to touch the eyes as less as possible. Second thing is to use the prescribed medications regularly. More important कि conjunctivitis, as we have seen, it spreads in the family. So basically, we don't want that the entire family is using the same medicine, which is what they tend to do, because one person gets the antibiotic and then in next person gets the redness, they use the same eye drop. So the eye drop may be a source of spreading the infection as well. So not to do that, to use fresh medications for each person. To avoid using handkerchiefs as much as possible, preferable to use tissues so that you can clean your eye and immediately throw it away. Sanitize your hands each time when you touch your eye or apply medications. Wash hands frequently, especially when you're touching some other surface. So to keep lots of sanitizer available, or just to keep washing hands with soap and water very regularly. If possible, avoid being in the same room as the person who's infected. So sharing the same bed, sharing the same linen, all this helps in spreading much faster. And definitely to avoid work and going out in crowded places.
Ma'am, I'm sorry to interrupt. Actually, could you make Dr. Varshini co-host also? I by mistake made you host, so I can't change the setting now. So, so you just have to press the on the screen where the ma'am's Dr. Varshini's photo is showing. Just click on that, and that 3 dots will come. Just press that, and उसमें make co-host option आएगा.
एक मिनट.
Just
Yeah.
make co-host.
Yeah.
Dr. Varshini and me also,
Yeah.
ma'am. The Shroff Eye Centre also, if you could just make a co-host. The same
Okay.
way. Thank you. Sorry.
Yeah.
Please. So one question which also is very commonly asked is ki swimming pools, is it safe to swim?
No. Absolutely big no.
So right now is all this everyone wants to go swimming is not a good idea to go swimming.
Yeah, not at all, because that's one big area from where we can get conjunctivitis.
Yeah.
And another big thing, people who are using contact lenses, please avoid using contact lenses when you have conjunctivitis. We've seen bad corneal infections with the use of contact lenses over the eye which has got conjunctivitis. They think they are mild. They think there's mild redness, less redness. And so that's a big no, which one should do when you have a conjunctivitis.
Okay. And what about what about eye makeup?
Again, better to avoid. Better to avoid. Rather, I would say no. Not even better to avoid, but no. No eye makeup. Don't touch your eyes. And of course, don't share your eye makeup with anyone else, because see, simple conjunctivitis comes, it peaks on the second day or maybe on the third day, and then it goes away. Usually, it is going off in 4 days or 5 days maximum. But if suppose you apply eye makeup, there would be a lot of foreign body particles roaming around. And what we are bothered about in viral conjunctivitis, because it's natural cause, it goes away, but it's the secondary infections which are sight threatening. So we don't want any secondary bacterial infection happening with viral conjunctivitis. So if you use any eye makeup, chances of you getting secondary infections is higher, and which can be problematic to treat. So therefore, don't use any eye makeup when you have conjunctivitis.
Okay. And then if the patient, suppose they do get conjunctivitis, they'd been wearing contact lenses, तो वो वाले contact lenses हमको फेंक देने हैं या फिर use करने हैं, क्या करना चाहिए?
बेटर है कि वन शुड यूज डेली डिस्पोजेबल कॉन्टैक्ट लेंस. बट अगर मैं आज कॉन्टैक्ट लेंस पहन रही थी एंड आई गेट कंजंक्टिवाइटिस, प्लीज डिस्पोज देम ऑफ. क्योंकि अभी हमने ऑलरेडी बोला है दैट don't share your thing, though you may be wearing contact lens, you come and put it, but there may be secondary infection coming on that contact lens surface, so which can give you bad corneal infection. So please throw away that contact lens if you've got conjunctivitis in that eye. Yeah, Varshini, you want to say something?
No, I just wanted to say, Dr. Kamna, on the YouTube live, I think you need to go into like a gallery view.
I've been trying, I've not been able to figure
because right
out.
now
only my face is
I've
showing.
gotten a couple of messages that only you are visible.
Yeah, I've been desperately trying to figure out what to do and I can't see. So if anybody knows what I'm doing wrong or some, please tell me, because I've been desperately trying to set this right. So I ultimately gave up and started recording the thing so we can put it out again. But I can't find where the gallery view is. I'm already on gallery view on Zoom, so I don't know why this is happening. Should we end it and start it again? I have no idea. Oh, oh God. Anyway. No, I can't see it. So if anybody can suggest what is to be done, I would know maybe what is to be done, because I'm unable to see what to do. And there seems to be no gallery view here. Like, I think maybe we can just end this live stream and start it again. I don't know. How would that work? Should we try it?
Are you getting any questions? Kamna, are you getting any questions?
No, I'm not actually on this. So I don't know what's going on. There are some people who logged in, but I'm not getting questions. I think because we may be covering also questions, but should we redo it again? Should we leave this and join it again? Because otherwise,
Sure.
आप दोनों के faces नहीं दिख रहे हैं.
Sure.
Let me just see if we can just redo it. But I don't know, that live stream will finish then, and we'll have to start a new one basically. Okay, so let's try it. Let's log back on. You all can stay on Zoom. What we'll do it, we'll restart it.
So we stay there?
Yeah,
Okay, we
ma'am,
stay or we
I'll
leave?
just end the live stream on YouTube, not here. This is Zoom.
Okay.
Yeah.
Okay.